Hello, so this is Chapter 12, Hallucinogen Misuse. A short history of hallucinogens. Approximately 100 different hallucinogens compounds are found in various plants and mushrooms. Psilocybin in mushrooms in southwest United States and northern Mexico, synthetic hallucinogens such as PCP, chemicals produced by ergot fungus, which grows on grain. Then you also have LSD, lysergic acid diethylamide 25. Became focus of informal research as a way to liberate the mind from conventional thought. Boom in popularity beginning in the 1950s. Scope of the problem. About 15.3% of those over 12 years of age in the United States have used LSD once in their lifetime. In the last year, 9.5% had used LSD, 2.4% had used PCP, and 6.8% had used MDMA, or ecstasy. For most who misuse hallucinogens, their use is transient. Hallucinogens use is generally on the decline. Salvia diurnum is an exception. Effects of hallucinogens are affected by dose administered, specific compound use, and route of emission. Thought to alter serotonin 2A and dopamine receptors. Commonly abused hallucinogens divide into phenethylamines, which is your mescaline and your MDMA, and your tryptamines. Other authors make categories by psychedelic, entactogen, and dissociative anesthetic. Methods of misuse. Hallucinogens might be ingested orally, smoked, snorted, or injected. The method of abuse depends on the specific compound being abused. The dose needed for effect also depends on the usage history. The pharmacology of LSD. LSD is a Schedule I substance with no medicinal value. The molecule is water-soluble, and so is rapidly absorbed from the GI tract and distributed to all blood-rich organs. Highest brain concentrations are found in visual areas, limbic system, and reticular activation systems. Tolerance can develop within 2 to 4 days of continual use, but abates after 2 to 4 days of abstinence. Biological half-life of LSD is 2.5 to 3 hours. Perpetual distortions last 12 to 18 hours after ingestion. The subjective effects of LSD, 1 of 4. First effects is felt within 5 to 10 minutes of ingestion. Negative effects include the following: symptoms of anxiety, gastric distress, the tachycardia, increased blood pressure, and body temperature. Dilation of the pupils, nausea, and muscle weakness. Exaggerated muscle reflexes, dizziness, and muscle tremors. Hallucinogens effects of LSD usually begin 30 to 60 minutes after ingestion and last as strength for 2 to 4 hours. Subjective experience is affected by the following: personality, expectations, environment of use, and the dose ingested. LSD experience is referred to as a trip. Loss of psychological boundaries, enhanced insight, heightened awareness of sensory perceptions, enhanced memory recall, feeling of contentment, a sense of being at one with the universe. Stage 1, within a few minutes, individuals often laugh or cry and feel a sense of euphoria. Stage 2, 30 to 90 minutes. Individuals experience perceptual distortions, visual illusions, and synthesis. Stage 3, 3 to 4 hours. Individuals experience a distortion of a sense of time. Individuals feel possessed, a sense of quasi-magical powers. The loss of reality is potentially fatal, as it can lead to suicidal actions. Factors influencing probability and course of the trip. Individuals expectation setting of use, the psychological health of the user, and feedback from others. Normally lasts only 6 to 12 hours and can activate lightened psychosis. LSD flashback symptoms categorize perpetual, somatic, and emotional issues, and depersonalization. Drug interactions involving LSD. There are case reports suggesting that SSRI antidepressants might trigger or exacerbate LSD-related flashbacks or induce grand mal seizures. LSD can interact with the antiviral agent ritonavir, which is used for treatment of HIV infection. This results in a high blood concentrations of LSD. PCP, originally developed as surgical for anesthetic, unintentional use remains very real. Often an adulterant of other compounds. Not currently popular in the United States, and use in other countries is rare. Methods of administration: oral, intranasal, intravenous, injected into the muscle tissue, or smoking, which is the most popular. Subjective experience of PCP. Experience of rapid fluctuations in level of consciousness, a sense of dissociation in which reality appears distorted or distant, euphoria or decreased inhibitions, feelings of immense power or analgesic, altered sense of time, loss of sensation in body parts, feeling they are no longer attached. Pharmacology of PCP. Soluble in both water and blood lipids. Accumulates in body parts with high lipid concentrations, such as the brain. Brain concentrations can be far higher than that in the blood. Effects depend on the experience, PCP, expectations, and drug concentration in the brain. Complications of PCP use. PCP-induced psychosis. First stage. Paranoid delusions, anorexia, insomnia, unpredictable aggressiveness, extremely sensitive to external stimuli. Talking is ineffective. Middle stage. Paranoid, relentlessness, but calmer and intermittently able to control own behavior. Final stage. Gradual recovery over 17 to 14 days. Social withdrawal and severe depression. Ecstasy, MDMA, initially developed as appetite suppressant. During the mid-1960s, some therapists suggested it may be useful for psychotherapy, though it ended in the mid-1980s. The most commonly abused stimulant in dance clubs, quote-unquote raves. Gradually, around 19.4 million people between the ages of 15 and 64 have used it at least once in their lives. Popular among older adolescents. The typical MDMA abuser attempts to ingest 60 to 120 milligrams at a time. Ecstasy does appear to have a ceiling effect, where positive effects do not increase but negative ones can. MDMA abusers tend to engage in episodic use of the compound. Though some users are so active, they can take over 40,000 tablets in their lifetime. Pharmacology of MDMA. A member of the same family of PCP compounds, but structurally similar to amphetamines as well, can be categorized as a hallucinogenic amphetamine. Most commonly used through oral ingestion, but powder consumption is growing and more dangerous. Effects begin within 20 to 60 minutes and peak within 1 to 4 hours. Metabolism rate can differ from person to person. It's a highly lipid soluble. MDMA can cross the blood-brain barrier into the brain itself without significant delay. Within the brain functions as an indirect serotonin agonist. Also triggers release of neurohormones that play a role in pair bonding. Effects strongest in the limbic system of the brain. There are different methods to make it. Specialized equipment and training are both required to avoid the danger of contaminating MDMA. Subject effects are divided into 3 phases: acute, subacute, and chronic. street reputation as a safe drug. However, small therapeutic window, significant overlap between effective and lethal doses. MDMA related cardiac problems can increase heart rate, blood pressure, and rate at which the heart muscle uses oxygen. MDMA abuse is the cause of cardiac arrhythmias such as the potentially fatal ventricular tachycardia. Can also be cardiotoxic. MDMA-related neurological problems, memory problems, loss of temperature regulation and sensitivity appears to lower the seizure threshold in abusers, may act as a selective neurotoxin that targets serotonin neurons. MDMA-related emotional problems, flashback experience, post-use anxiety attacks, persistent insomnia, irritability, drug-induced psychosis. PCP and hallucinogen use and DSM-5. So this is the list of those. I have a hard time, if you can't tell, pronouncing some of them. Paraclinidine intoxication. But yeah, anyway, so that's it for this video. Thanks for listening.